Hello, I just wanted to add this more as an additional resource than anything. Um, recently worked with Doctors Crookston and West and some IMA partners on a project in Kenya, and put together just a short paper of how that particular project used what we call WASH building blocks. I'm not an expert on the building blocks, that's for sure, but it was an interesting approach, really a systems thinking approach that was applied in this IMA project, a USAID funded project in Kenya. And so we wrote just a brief report, and we used, there's a group in the Netherlands called IRC, and they're the ones that have really developed this building block approach to WASH. And more than anything, I just want to point you in this direction. I will include a link to their website, and I might even include the paper that Doctors Crookston and West and I put together for that particular project. But this will be very brief. I just want to introduce you to this resource because we've talked so much about really just health promotion and health education, but to step back and recognize that WASH should not be siloed. It really should not be independent from other sectors, in particular health and healthcare, right? But also education. And like, we really need to work together. WASH is so influential across the board. It's not just something that we're concerned about from a maternal and child health perspective. Every community and every aspect, every community partner, every organization really should be focusing on WASH and WASH infrastructure and in improving the provision of clean water. It's a fundamental concern for nations and for communities across the board. So these are the 9 WASH building blocks. I might have just a couple of words to say about each as we go through. But again, this is expertly put together by a group out of the Netherlands called IRC, and they have so many wonderful resources. And they really work with government partners, with non-government, with nonprofits to really implement this systems approach to improving WASH and WASH outcomes. So first, just a real quick word on policy and legislation. It's absolutely vital that we come together. One thing that I might say about policy that I was taught in graduate school, which is one effective piece of legislation, so one policy is better than hundreds, if not thousands, of community health workers. In other words, this is really how we move the needle in health promotion, is we advocate for and fight for and push effective policy with our legislators, with government at the national level, all the way down to the community level, and make sure that we're establishing policies and strategies, and we have laws in effect that will really push our public health efforts related to WASH forward. So policy and legislation, really important. Planning, certainly we have all different levels of planning, but really coming together, bringing all of the stakeholders together. And so much of this systems thinking is getting outside of just public health planning and working with health clinics, but really looking at faith-based groups and education, and government, and specifically related to WASH, really looking at public works, the engineers on the side of water delivery and infrastructure, like really coming together and planning with all of those groups around the table is fundamental. Institutions, so I've talked a little bit about these type of institutions, but making sure that when you pull all of these stakeholders together, that we really are coordinating our efforts. And this is where we need to get outside of just our maternal and child health box and really think, okay, who else needs to be around this table? Who else needs to be involved? This is what was done at in Kenya so well, to bring different county levels of county government together, and really say, how do we coordinate our efforts? Because we're concerned about maternal and child health, or we're concerned about agriculture, but everyone else ought to be concerned about this too. And they are. It's just, are we talking together, or are our efforts still siloed and unfortunately still very independent? But we need to get this coordination together and bringing institutions together who care about these things, and leveraging a little bit of the synergism that comes from getting these groups together. Okay, finance. So certainly we need funding, and funding related to WASH can be a challenge at times. And what I mean by that is, so often funding is short-term in nature, and yet WASH is something that needs sustainable funding. So often donors want to see their dollars go towards something related to the infrastructure, where they can stand back and tangibly point out or see, okay, this is what our money did. This created this well in this community. And yet that funding needs to be long-term. Otherwise, we will have infrastructure that has not been maintained and efforts that are not sustainable. So the financial piece is crucial. And in health promotion and health education, we need to team up with those who understand finance and who can really guide us and inform us as we make decisions. So I tried to summarize this by saying flows and responsibilities. We need clear frameworks, including life cycle costs. Again, that's that sustainability piece that we're really looking for here for this particular building block. That very much leads into this next building block, which is indeed infrastructure. So we need to develop the infrastructure. We need to maintain it. And we need to be working with every single group. Again, every level at government, and all of the nonprofits and the education sector and the healthcare sector come together with public health to assure that we have the appropriate infrastructure. And when those that are working in public works, when they realize that they're being supported by all these other sectors, much more likely to over time establish an infrastructure that is sustainable and will provide water and sanitation for the people that we care about so much in public health. So regulation and accountability, this goes back to one of our first building blocks, which was where we talked about policy. Now, once we have an effective policy or a piece of legislation or some standards in place, we need to make sure that people are held accountable, and working with them as opposed to in opposition is most likely the best approach to take, I should say. And so regular contact with the regulatory framework, as I've said here, with those power brokers, so to speak, checking up regularly to say, okay, this is what was promised, this is what was set in place, and we need to know that that's happening. And when that's not happening, someone needs to be held accountable, and we need to make sure that we can navigate through those situations so that we can really get the benefit, reap the benefit of the policies that we have fought for and that we've worked so hard, those agreements that we've efforted over time to come into and to create. So monitoring, you're familiar with monitoring. We have lots of monitoring and evaluation in public health. And the same thing here, a systems approach is making sure that we have good data, and that data is coming in and informing the decisions that we make, and informing each of the partners around the table. So it's a framework for routine implementation at every level, using decision making and to making sure that we're on track to reach the goals and that we've set for our program. Okay, water resources and management. I think it's important that we really look at the whole life cycle of water. And that's really what IRC is promoting here, is that water is one of our most precious resources. So it's not just about the delivery of clean water, it's about reclaiming that water and recycling that, and really looking at water again as just a fundamental resource at every level. So I've just put here allocation of management, resource abstraction, water quality, coordinated efforts. So many things we've already talked about here, but really focusing on who's managing this water and where are the shortcuts. So what's the low-hanging fruit? How can we improve our management of water? And once we get healthcare involved and public health involved, and we get education involved, and we get every level of government involved, really supporting our public works, our water engineers, those that are managing and developing infrastructure, working together for how can we best manage this. This is something for those of you that have expertise in agriculture. This is something that should be very familiar to you, because water drives agriculture as well, and managing that water and managing these limited resources is essential for all of us, that's for sure. And last but not least, we need to always be learning and always be adapting. We need to be light enough on our feet in public health and in our interactions with these other partners, that we can pivot, so to speak, that we can make some changes, that we can use the feedback that we're getting from monitoring and from data and implement those things to really inform us and to guide us. So lessons learned, how we update, how we improve, and how we move forward. That is a building block that we will continually loop back on. We can't get heavy and can't get slow to respond to all these different pressures and these forces and the needs from different partners. So it's a really brief overview of the building blocks, and I'm sure it's weak and insufficient. Really, more than anything, I just wanted to point you in this direction. I'm not an expert in health systems, but I know enough to recognize that we can no longer work independently. We have to get many different people at the table, different groups who have some shared interests, some shared concerns. And again, water should be a shared concern of everyone, no matter where we live, no matter what challenges we're facing. So I just, in closing, I just want to point you to IRC. I will include a link to their website. Fantastic information, especially when you're in the process of really designing a program and faced with the question of who else do we need around this table so that we can be successful. That's where the building blocks really come in. Thank you so much. I wish you the best. I appreciate